So thank you, Maggie, for joining us this morning. So I'm here with Maggie Ray, who's the new President of the Faculty of Public Health. Maggie is the head of South West Academy of Population and Public Health for Health Education England, and also leads the South West Speciality Public Health Training Programme. Her special interests include health inequalities, workforce development, education and standard setting. And she's also visiting Professor of Public Health at the University of the West of England and has got extensive experience of working in public health at all levels. So Maggie, please tell us what are going to be your priorities for your term as Faculty President?
Well, I think the thing that's foremost in my mind, Angela, is actually our membership. I've worked on and off with the faculty for many, many years. I'm very proud that we have such an amazing UK Faculty of Public Health. I think we're the envy of every other country in the world. Our public health system is ranked as the best, and I really want to put the membership first. And of course we have many, many members who actually help us deliver the faculty's business, and for that I'm extremely grateful.
Thank you. So what are your plans to make the Faculty of Public Health a more powerful and prominent voice for change in UK public health?
Well, I think my first thought is collaboration. First of all, collaboration with the wonderful leaders we have in the public health system, many of whom most of them are fellows of the faculty. We've got our registrar group, which are an amazing group of leaders and can be, again, fantastic ambassadors. And then collaboration with the other public health organisations, the Academy of Royal Medical Colleges. I've met most presidents now, and every single one of them really care passionately about public health and health inequalities. So I think one person cannot begin to do it all, but I think actually asking for help, getting people on board, getting people to work with us. We have an amazing group of volunteers already, but I think that's what's going to really improve the faculty's impact.
Thank you. And what are your thoughts for over the next few years on what the Faculty of Public Health should focus on? I know you've mentioned membership, what else?
Yes, well, I think most of the ideas actually come from the membership. You know, we've got to remember we're a UK faculty. I'm very, very clear about that, and if people hear me talk, I'll get the UK in at least once in every conversation. But you know, we've got to think what's right for England, what's right for Scotland, what's right for Wales and what's right for Northern Ireland, and try and collaborate and bring that together. In some ways it's a great strength that we're a UK faculty, but there will not be the same priorities in each of those 4 countries, and we need to be respectful that there is devolved systems that we're working with, and we have to remember to set the priorities. I'm sure at the heart of everything I do will always be health inequalities, reducing health inequalities. But I'll be very much in listening mode to what people consider to be really important.
Thank you. So thinking about the fact that the faculty represents all 4 countries of the UK, obviously they all have different funding systems, but they're all being impacted by austerity. How can the faculty campaign for better public health funding across the UK?
Well, I think in the faculty, again, building on the excellent work that was done prior to my time by John Middleton and other colleagues, I'd like to recognise that. But I'm very clear that we are lobbying for £1 billion coming back into the English system. And as you say, the finances are very different in other countries. But you can be passionate about prevention and very committed, governments can be very committed to reducing health inequalities, but we do need money for prevention, and we do need to make sure that the money that was removed from the public health system is reinvested, and we could do with more. Absolutely.
And what do you think England could learn from the devolved nations in terms of public health?
Well, I think we've had particular difficulties in government over the last period, haven't we? It's been very difficult to get anything forward. And I think the kind of lobbying that happens in other countries, and indeed other countries across the world, I'm always amazed when I look at some of our colleagues who are working in Africa, China, Hong Kong, other areas of the population, India, Pakistan. We've got people working all over the globe, and I'm always amazed about how much they can achieve with very little resource. So I'm very open to learning from others, but it is an area that we will have to lobby for and really help people, if they don't understand already, be really clear about the importance of a good public health system.
And thinking about how we'll work with international parties, obviously one of the big things that's hitting the news is Brexit. How is that going to affect how we work across Europe and how we work with international partners?
Well, I think collaboration is the key, and I'm extremely proud of our Brexit campaign, Do No Harm. It was particularly relevant, I think, for England, but I think at the heart of the Brexit arguments is the fundamental issue of poverty. And I wouldn't like the recession and the poverty that we're experiencing in all 4 countries of the UK to be overshadowed by a Brexit discussion. We have very, very good systems in preparation for things like infectious diseases, and the faculty is very much at the heart of the Academy of Royal Medical Colleges in the preparations for Brexit, along with our other public health organisations.
Brilliant, thank you. So thinking a bit wider then to workforce, which I know is one of the things that you're particularly interested in, what do you think is going to be the future of the public health workforce in the UK?
Well, I'd like to see it expanding, and I'm very keen it does expand. I'm extremely excited by the work I personally am doing in the integrated systems in England. We have to remember that's very much an English agenda, but we do have changes and different developments happening in Scotland, Northern Ireland and Wales, which we have to also plan for. And I think any organisation will really benefit from having excellent public health leadership, and I'm lobbying very hard to make sure that we have public health consultants in every NHS organisation, and indeed in any the great system we've got in local government. We do have to work with both those systems. They need each other, and we need to ensure that we're leading, providing the public health leadership right across the system.
You mentioned that the relationship between NHS and local authority for public health. Obviously in England, public health moved to local authorities, the sort of local responsibility. What do you think the future of local public health is going to be in England?
Well, I believe the future is going to be very, very good for public health, because I think people are beginning to realise through knife crime, drugs and alcohol, that really what we need is a public health approach. And it might seem strange to us who are public health people that people should discover there's a public health approach. But the public health approach is fundamentally about utilising all the resources of society to tackle these problems, with trying to tackle them before they become problems in the first place. So I think we are getting that message across, and I think we have many excellent leaders right across the system who are delivering those changes and really impacting. What we need is more support and making sure that people understand that that's the kind of leadership public health can bring.
Brilliant. So thinking about then the changing roles within local authority and national bodies like Public Health England and then the NHS, how can we ensure that senior public health workforce can move between roles without being penalised either professionally or financially?
Well, I think that might be relatively more easy to do than people actually understand. And I personally I started off in local government, I moved to health, I moved back into local government, and now I've moved back to health. So I think the transfer between organisations can be done. I think we probably need to find a stream within the faculty to help people work with these new systems, and also sometimes to understand that in the context of employment, some organisations, it's negotiation. not a given that you'll be on a certain salary. And I think for many of us, we haven't experienced negotiating our salary. That, for instance, is very, very common in local government. They don't really expect you to accept the level that they've offered you in the first place. And that may come as a surprise to people. So I think we have to do as much as we can to support people. On a very specific with that, Angela, we did actually do some work when I was registrar with the standing group on local public health teams. And we actually produced a document with NHS employers that was an agreement the different employers in, say, an ICS system could use to transfer employment between the two. So that is readily available. Maybe we've got to do more to market it.
Excellent, thank you. So thinking about the wider public health workforce, how is the faculty implementing the strategy for increasing behavioural and social sciences expertise within the public health workforce and possibly the wider workforce, again thinking about violence prevention?
Well, I think that's a really good question, and I'm very, very proud that the faculty has opened up its membership. So I think we're one of the few medical colleges that actually have that wider membership. So I think that's something to be very proud of. I think there's maybe one or two others that are trying to go down that route, but probably not as extensively as the faculty has done. We have been sponsoring, I think, quite an important award system for allied health professionals that I think is really helping with getting the recognition of people from other areas. And I think we've got to use things like the policy within the governments of the UK. We've just had the Green Paper on prevention, and that's got quite a lot in it that will be very, very helpful to the wider workforce. So I think we've got to use all of those resources to try and strengthen the whole workforce.
Great. So thinking then again about the role of public health specialists going forward, what do you see the role of the public health consultant in the future as being? What new skills will they need?
Well, again, it's a very interesting exercise, and that's one of the reasons early on in my presidency I wanted to come along and speak to your group, the registrars, and I wanted to keep on my role as head of school in the Southwest, because I think it keeps me in good contact with young people who are starting out in their careers. And it gives me a great opportunity to understand what the requirements are. At the moment, what seems very important is the work we've been doing on healthcare, public health. I think most programmes now have quite a strong strand on healthcare, public health. Perhaps that was a bit weaker a few years ago, but it's very important to understand how hospitals, primary care work if you're going to make a contribution to an integrated system. I also think that we've got a really excellent opportunity on system leadership, and I want to collaborate with Jim McManus and other colleagues at the Association of Directors of Public Health, who are also very interested in creating system leaders into the future. So those two seem very, very important priorities. But again, I want to be listening to I can't easily put myself in the circumstances of someone in training or starting out as a consultant, because obviously I've been in that role for a very long time. So I think it's important to listen and actually understand what's needed.
Thank you. And thinking of the public health workforce outside of specialists, often workforce development is really based on local leadership, and we know that most public health systems have been impacted by austerity, particularly in England. What do you feel is the role for the faculty in creating multidisciplinary public health training for the whole of the UK?
Well, I think, as I say, we have to be very proud of the fact that we're a medical specialty with a multidisciplinary entrance route. At the moment, we're the only Royal College group that has that, and that is something that is, I think, very important for multidisciplinary public health. However, we must have equivalence. We absolutely must have equivalence. We can't have one group being less able or less qualified than another. It has to come to a Standards are very important to me. So I think we have that. I think if we're talking about the people aspiring to that role or people who are practitioners, I think we've worked extremely hard as a faculty with Health Education England to get a robust commitment to this right across England, and similar conversations with the other 3 countries. I think it's building. I think it's growing. I think there's more recognised programmes in each region, and we all have the delight of attending a meeting on the 8th of August to discuss the variation in regions, which I think will help.
Great, thank you. And then lastly, what do you see as the role of registrars, so specialist trainees, in terms of advocacy and campaigning for public health?
Well, I think anyone that works with our registrars will know they're a very passionate group, very passionate about public health. We're fortunate in that our specialty is completely oversubscribed, and so we have amazing people, amazing talented people coming into public health, and I think it's about letting them follow their passions and really supporting them in becoming the leaders they want to be. And it's very interesting to me that you and I are sitting here in a very hot room, Angela, probably on the hottest day on record, 39 degrees. So it's lovely to hear the passion around climate change, sustainability, health inequalities, poverty, all the things that registrars really care about, because that's what brought them into public health in the first place. So I think we have a real opportunity to work closely with them and for them to really feel part of the leadership of the faculty.
Thank you.
Thank you.